Evident mutation. The language we use to communicate about the pandemic and the virus has a significant impact on our attempts to curb its spread. Let's discuss this now with Professor Moshabela, Dean of Medicine at the University of KZN. Professor, thanks very much for your time this afternoon. So in a recent Twitter thread, you identified some problematic words or phrases, and I want to look at those in some detail. What, in your opinion, is wrong with a phrase that we've been using quite a lot throughout this pandemic, non-pharmaceutical interventions, another one that's cropped up recently, second wave, and new strain, and that's referring specifically to the mutation of the virus?
Yeah, so I think let me start with the new strain because it's a recent story and it's important because it's got serious implications. And if you would recall, yesterday during the briefing, the presenters, including the Minister and Professor Curry, made it very clear that they want to refer to this as a variant, not a strain. But because we tend to use language loosely, then most people are referring to it as a strain. And related to that also, they kind of made an indirect association between the virus and the strain, the variant and young people. And people started to think that basically it was implied that this causes severe disease in young people. And these things, it was made clear that they don't have evidence for that. So it is this sort of messages that get lost in translation when we communicate science that bothers me. And we don't have a strong kind of health and science communication in South Africa. And we kind of need to guard. Generally, it shouldn't be the job of the scientists because scientists are not really trained in science communication. But when information then is translated to the public, we end up with a situation where people start to talk about new strains. And this will either cause a lot of anxiety or cause a lot of misunderstanding in terms of people thinking that whatever interventions we have in place are not going to work, even though it was made very clear that in terms of our approaches, we are going to use the same approaches. So my attempt was to try and basically dispel some of those kind of perceptions, to just make sure that we bring people back to the focus in terms of the development from a science perspective, but try to make it really understandable in simple terms.
For people who haven't, sorry, Prof, for people who haven't read that Twitter thread, what was the problem or your problem with the phrase non-pharmaceutical interventions? Because I think that's quite a key definition as well in terms of how we relate and understand to the kind of regulations that are in place.
Okay, so in general, if you understand our healthcare system in South Africa, we have a very sort of curative biomedical model of care, and we tend to focus a lot on, even at the moment, we focus a lot on hospitals and clinics, and we don't engage a lot with so-called behavioral interventions, social interventions. Even though we talk about them, we don't actively do that. So there is a tendency to kind of use this sort of approach of a pill for every ill. And when that happens, we end up with a situation where people refer to, pharmaceutical, referring to medication. And there's an expectation that for a cure or treatment, you must get medication. But in this case, the virus is teaching us that actually we need to depend a lot more on preventive measures rather than pharmaceutical interventions at this point. Until we have a vaccine, we don't have effective therapy, we don't have cure. Hospitals are full because we don't really effectively implement all these other so-called non-pharmaceutical interventions. And people cannot understand when you say non-pharmaceutical. What does it mean? Why is it that when we refer to vegetables, we don't say non-meat, we say vegetables? Let's just call it what it is and say behavioral interventions or environmental controls or whatever it is that we are referring to, so that there's no misunderstanding. We cannot take it for granted that people understand. And it's a very biomedical way of thinking that marginalizes other forms of interventions. And at this point, we need all disciplines and sectors of public health to come to play, not marginalize them.
Some people might be inclined to say, oh, well, this is semantics. We're being pedantic. We've got larger fish to fry. But ultimately, could using the wrong phrases to try and understand this virus reduce our efficacy in curbing its spread?
So, I've been involved in the sort of COVID response since the beginning. And I know that it's not just semantics. There are underlying philosophies, behind those expressions. someone is going to talk of non-pharmaceutical interventions, they come from a particular school of thought. And if we reinforce that school of thought that marginalizes other role players in terms of preventing multisectoral responses, then we are compromising our response. The original MAC was criticized for not having enough behavioral scientists. Now they've added them. But because they've added them, we shouldn't be continuing to think from a non-pharmaceutical or biomedical perspective. We need to see this COVID-19 problem as a broader issue that's got social implications, economic implications, and many other implications. And we need to be clear about what interventions we need to add as layers in our complex response to the problem, not just focus on biomedical responses.
You say, in fact, that these phrases amount to misinformation. What's ultimately the danger or the psychological impact on people who essentially all of us rely on to implement these non-pharmaceutical interventions or to stick by the regulations in order to try and overcome this pandemic?
Yeah, so, I mean, for me, I think that clear communication is important. If you want people to understand what you're saying, you need to call a spade a spade. Call it what it is. Don't use a lot of jargon that they need to go and find out what it means. Otherwise, they just stop listening. It happens to a lot of us. If I get into a modeling class and I don't understand the jargon, I switch off. My brain switches off. We need to make sure that people's minds don't switch off. And also, if they hear a word that sounds like it's something that is way too dangerous, they also survive by, burying their head in the sand. They don't want to deal with it. But there is this sort of overwhelming sense of inevitability when you're dealing with something that you don't understand or you don't have control over. What we need to do is to make sure that we break down the facts in simple terms for everyone we are very diverse in South Africa, from all corners of people in South Africa, to understand and be able to know that they are capable of dealing with it in their own way. And not necessarily wait for some savior to come from somewhere else. It can be very disempowering when you're overwhelmed with a sense of inevitability and you don't know what to do. Like there's only death. And we need to be empowering people by making sure that they understand how they fit into the program and what role they need to play and exactly what they have to do. If you just tell people to wash their hands or to, use masks, it's good. They have the knowledge. But for people to be able to effectively respond, they need to have the skills, they need to have the motivation, and they need to have the confidence to be able to do things that they're supposed to do. And so we are used to the type of health promotion that just gives people messages or gives them information. It's not enough. We need to be able to empower people with skills. And this is all health promotion principles that we should be adept at, but we are not, because we don't necessarily focus on so-called upstream factors or social determinants of health. We tend to focus on the presenting problem, the clinical problem in front of you. But COVID-19 basically demands a response that actually deals with broader issues and gets citizens engaged in the response, not for them to be passive.
We had been making great strides. This is my personal opinion, but I think in terms of getting that message across over the past 6 to 8 months, reinforcing that message repeatedly, this new variant of SARS-CoV-2 has the potential to derail that, especially in light of the increased anxiety that it is causing. According to you, it's not time to panic yet. Why do you say that?
Well, I think it was a clear message that was communicated last night when the briefing happens, that we've got reason to be concerned, but not necessarily to panic. And the reason is that we understand that the variant is more of a virus adjusting a little bit. And the way I see it, it's like it's firing a warning shot. And we have to be able to recognize that we need to buckle down and get serious in our response. But at the same time, it is not necessarily it's not undergone such major changes that it requires for us to approach it differently. No. We're still approaching it the same way based on the information that we have. Until we have information that suggests otherwise, our approaches will work if we implement them effectively. And so right now, I think that when people start to think that, we've got a new strain, it's almost like there's this overwhelming sense that there's nothing I can do. This virus keeps changing, and so I might as well let it hit. But actually, if we empower people with exactly the information that they need, which was done yesterday, but it was done with very scientific jargon, and a lot of people came out of it saying that we didn't fully understand, that went over our heads. So we kind of need to take the time to bring people on board in terms of their understanding. It's good to share scientific developments, but we need to make sure that people can process it and see how it applies to them individually and collectively. So for me, I really believe that based on the evidence that's presented, we don't necessarily have to panic, but we need to be concerned enough to make sure that our response is tightened. We need to tighten our seatbelt. But it's not really for us to panic.
Well, thank you very much for taking the time to speak to us. That was Professor Mosa Moshabela, Dean of Medicine at the University of KZN.